with a very heartbreaking but important conversation to have, especially if you have children. Alabama statistics show that we rank third in the country when it comes to sudden, unexpected infant deaths.
Yeah, doctors and nurses at DCH Regional Medical Center in Tuscaloosa are working now to help prevent these tragedies. Your Tuscaloosa reporter, Brian Henry, joining us live and on your site to explain exactly what they're doing.
Well, Morgan and Sarah, according to a longtime DCH pediatrician, most of the sudden unexpected infant deaths happen because of improper sleeping practices. In other words, the baby is face down in the crib or co-sleeping with the parent.
At ua.edu.
Dr. Brian Gannon has seen it and felt it one too many times, the heart-wrenching tragedy of a perfectly healthy infant slip away for no apparent reason at all.
I can tell all sorts of stories, but I mean...
Today, though, the story is about how such a thing can be prevented. According to DCH, 391 babies died in Alabama in 2022. Of that number, 105 were sudden unexpected infant deaths, also known as SIDS.
Many times it's because the baby is face down in the crib or maybe co-sleeping with the parent or one of the other family members. And that's really not a safe situation for a young infant. And unfortunately, one of the other things that we know is that of the SIDS cases in Alabama, over half of them are among African American families.
Dr. Brian Gannon says it's a preventable death, and to illustrate that point, DCH requires all new mothers to watch a video that helps them follow guidelines to properly care for an infant in the crib. In other words, make sure the baby sleeps on its back and remove potentially deadly items such as a pillow or soft blanket.
Baby may have their face in that and forget to breathe, basically. The safest way for babies under 6 months to sleep is in a crib by themselves on their back.
And there's more.
There's a program through the Department of Public Health in Alabama called the Baby Box Program, where there's a little box about the size of a crib that can be in the bed with the parent, but that way the baby has their own space, so there's no real risk of the mother or the parent rolling over on the baby.
It comes down to this: education in eliminating clutter in the crib that could snuff out a new life just beginning. And again, Alabama is not alone. Dr. Gannon says Mississippi and Arkansas rank higher. Your reporter in Tuscaloosa, Brian Henry, WBRC 6 News, on your side.
New on the 4.